Today we're going to discuss the clinical preparatory sequence involved in getting a patient ready for any of the Cox procedures. There's basically three phases to it. We have the table preparation, we have the patient preparation, and then we have the doctor preparation. And we're going to go over all of those in detail. Let me start by giving you some information about how to help the patient get onto the table by minimizing the amount of pain they have. And we're going to go to a few slides in order to do that. So here we have some information on lumbar spine stabilization, and it's primarily done by increasing what's known as hoop tension, which is the tension exerted around the circumference of a round object, such as the abdomen. And hoop tension in the lumbar spine is increased by having the patient contract their transverse abdominis muscle. And that's just some simple anatomy, which we know you already know on the transverse abdominis, and the internal oblique is also involved. This is a better explanation of hoop tension. And you can see the snake, and then to the side of the snake we have the vertebral column. And you can see it's basically conforming to whatever configuration the snake goes into. And then to your right, you can see that we've got a grasp around the snake securing or stabilizing the vertebrae. And this is the same concept that would be applied to the lumbar spine when we're having the patient get on the table. We want to increase their hoop stress or their hoop tension, in essence forming basically a built-in lumbar support system. So it's very simple. You basically ask the patient to pull their belly button in as far as they can, and that will tighten the transverse abdominis muscles. Now that can be enhanced by also asking them to contract the buttocks. So before the patient tries to get onto the table, you explain to reduce the amount of pain or minimize the amount of pain that they might experience in mounting the table. Pull their belly button as far back as they can, and then squeeze the buttocks. That will form a natural brace around their lumbar spine, minimizing movement and helping to reduce the amount of pain involved in mounting the table. That's a basic explanation of lumbar spine stabilization. One other concept is getting the correct amount of pressure in the table to match the patient's weight. And so we have a pressure gauge. The basic formula is for a 150 to 200 pound individual, which is your average individual, you want to set the dial at 40 psi, 40 pounds per square inch. For each additional 50 pounds, you would go up approximately 10 psi, or for a reduction in weight, you would go down 10 psi. So if a patient weighs 175 pounds, that's between 150 and 200, you set the pressure at 40 psi. If the patient weighs 250, so that now we have an additional 50 pounds, you would set the pressure at 50 psi. If the patient weighs 225, you would set the pressure at 45 psi. That's the basic concept. Okay. All right, so the table preparation sequence is listed there for your convenience. The first thing we do is we prepare the table. We need to check the drops and the locks so the patient is not surprised by a cocked drop piece. We then ask the patient if they have a preference for the height of the table, and then we can go ahead and set the air pressure. So when we say check the drops and the locks, we basically go over Make sure that none of them are engaged. What you might find is one of the drops may be engaged, and if a patient in pain gets on the table in this manner, it's going to jar them, it's going to possibly frighten them and increase the amount of pain that they're in. So we don't want that to happen. Check your drops, make sure they're all disengaged. And then you want to check all the locks, and we'll go into a little bit of the anatomy of the table in just a moment. But all of these handles should be perpendicular to the floor, pointing straight down, and that means that everything is locked and secured. All right, so while we're at it, let's go through the brief anatomy of the table. This is the basic control panel. That's your on and off switch. When it's green or illuminated, the table is on. The main switches that we will be concerned with is that one there. When it illuminates, it says flex or flexion on it. And when engaged, this foot pedal that's on the floor is now controlling air in and out of that pneumatic cylinder right there, and that's going to increase the tension in this caudal section right here. So there's an up arrow that will increase air pressure, which you can see. If you watch the dial, you'll see the air pressure is going up. Okay, and then if we hit the down arrow, it will decrease air pressure. Okay, so once again, you ask the patient their weight. If they weigh between 150 and 200 pounds, you set it at 40 psi. That's a good starting point, and we'll show you how to properly adjust that when we get to that point in our demonstration. These are ankle rests. This one, the more caudal rest, is movable. There's a little switch that you can engage by pulling it towards yourself, and if you hold it, you can then move this back and forth, and that switch is right behind this wire here. This one is stationary. This would be the caudal or the pelvic section. This would be the lumbar section. This would be the thoracic, and that's the cervical section. They all have automatic drops on them. These dials here control the tension of the drop. This lever here is the most often used lever, most important lever, and it releases this caudal section here. So very carefully, if we stabilize the table and release, this section will now go up and down, and the amount of tension on this section here is controlled by the amount of air in the cylinder. So if we let air out, this becomes very loose, very free-flowing, easy, and then if we put air back in, it becomes more stiff and rigid. And then it's locked down as such, and now it's secure. This is the lateral flexion release. This one does not require any stabilization. You can just let it go, pull it back, and now the table will tilt from side to side, enabling us to initiate lateral flexion movements during our procedure. And again, that's locked by putting it down. Though it's not in the context of this course, this will engage the pelvic drop, the lumbar drop, and the thoracic drop. And this switch over there, it has the abbreviation DIST or distract. Now the foot switch, if pressed, will cause the table to go into a Y-axis formation or increase the length of the table, and then that will put it back to where it was, and when appropriate we'll go over the different uses of that function. One other function, a really good and important one, is the table has a vertilift function. On either side of the table in the front we've got an up and down button, and that will raise the vertical height of the table, which is excellent for both the patient and the doctor. For the patient, it gives them an easier platform to mount. For the doctor, it raises his work higher so that he does not have to bend over and potentially injure his back throughout the day. And this is the tiller bar. The tiller bar does go in and out, and when placed in, generally speaking, the angle should be going towards the rear or the caudal end of the table, just as you see it. Unless you are extremely, extremely petite, you would always want it to go in that direction. All right, so let's get a patient and begin to demonstrate. Shannon? Shannon, come on over here. Wonderful, thank you. Okay, so again, we mentioned check the drops and the locks, and the table elevation. We'll just make believe that Shannon is in pain and say, Shannon, I know you're in a lot of pain, so in order to mount this table, we can adjust the height for you. What would you prefer? Would you prefer it all the way down? Would you prefer it raised? Down. Down, good, okay, let's keep it down. And then Shannon, I'm going to assume that you are less than 150 pounds.
Yes.
Okay, all right, so Shannon is likely between 100 and 150, so we're going to, instead of being at 40, we're going to drop it down to around 30 to 35 pounds. Okay, so again, if we want to engage this pneumatic cylinder, we hit the flexion button, and now you can see we're at about 40 plus pounds, and we're going to bring this down somewhere, it's probably around 30 or 32, which should be appropriate for her weight. All right, so it's very important that you take notice of the patient's garments. If they're wearing a belt, the belt must come off. The belt will only encumber your ability to work with the patient's spine, and it may also damage the material on the table. So if they're wearing a belt, belt is off. If they have a pants with a button and a fly, you have them open the top button and lower the fly about halfway, and then you'll be able to maneuver their clothing once they're on the table. Young lady, are you wearing everything flexible? Good. Okay, so again, Shannon, I know you're in a lot of pain, so I want to teach you how to get on the table and minimize the amount of pain that you have. Okay, the basic mount is going to be like this. You're going to grasp the table here or at the armrests, and then you're going to lay the body flat down, face goes into the paper, but before you do that, to stabilize or minimize movement in your back, I want you to tuck your belly button in, hold it tight, hold your buttocks, squeeze them together, keep it that way, and then slowly mount the table. Wonderful. All right, now the first thing I do, and this is for my benefit, is I'm going to raise this as high as it'll go so I don't have to bend over when I'm working on the patient. And we may need to adjust that height as we proceed onward. Okay, the tiller bar goes in. Now we want to position the table so that the lumbosacral spine is in the appropriate area, and we get the most traction or the most advantage over that area as possible. The landmark that we're going to look for is the ASIS, anterior superior iliac spine. Young lady, I'm just going to gently grab the hips. All right, the ASIS, she happens to be positioned perfectly. The ASIS needs to go approximately 2 inches up from the most caudal or inferior aspect of this lumbar cushion. So the ASIS should be right about where my finger is. Okay, and if we touch, that's exactly where they are. Now once she's positioned, we can get a little tension out of the lower extremities by getting a little plantar flexion into the feet by bringing that backwards. And then, young lady, can I expose your back? All right, so what we're going to do is take the shirt and roll it under itself. That helps to keep it from rolling back. And then take the pant band and roll it down so that you have a nice work area right there. And you're perfect. Okay. All right, let's see if we left anything out. Now we want to fine tune the amount of pressure. Okay, in order to do that, we have to release this caudal section. In releasing it, we must be very careful to stabilize it for any chance that it might jerk up or flop down. Easy enough done with your inferior thigh. Just place it against the table with your inferior hand. Grasp this section right here, and then bend forward and release the lever, anticipating that this table may go up or down and trying to stop that movement. Okay? So we did good. All right, then we're going to slowly let go and see what we've got. What we're looking for is we want the table to go down easy, and we want it to come up without having to pull it up. Okay, so she is set about perfect. I might add a little air just to get a little more bounce to it, but actually not fully necessary. All right, so I think we've done everything for patient preparation. No, you're good. You're good. You're going to be there for a while. All right, so I'm going to lock this down. Now we've got doctor preparation, okay? The height of the table should be in the upper third quadrant of the quadratus femoris muscles. So table is set good for me. In terms of where you need to be along the length of the table is your thighs want to split her knee. That's a good starting point. And then you want to take what we'll call the contact hand and put it out about a 30 to 45 degree angle, and you want it to land in the area of her lumbosacral junction, which is where we're going to be doing most of our distraction. Okay? All right, and then what you want to try and do is learn to balance. You want to get a fairly wide bent knee stance, because you want to be able to get your body, especially the center of gravity of your body, your xiphoid, you want to get it over the table without falling over or feeling uncomfortable or uncoordinated. Because when we distract, the contact arm needs to go straight up the long axis of the spine. So we need to get our body far enough over that we're going to be able to do that. Okay? All right, and that should end the preparatory sequence.